All right, here we go. Hi, everybody. I am Tony. I am the outreach coordinator here at AMI-Quebec. Right to my, I guess it's my right. I don't know if it's my left or right. I'm really bad at this. Is Himat, and to my other side is Elvis. We are doing our regular hot topics. This topic tonight is going to be about racism and mental health. So we are here to answer questions. Before we get really started, I'm going to have each of us introduce ourselves and just let you know where we're coming from and what we're bringing to the table. A little technical stuff. If you want to ask any questions, you can do so by asking it in the comments, and it'll pop up and I'll see it and we can answer that question immediately. You can also ask any questions. I'm going to pull up the link right here. It is on our Hot Topics page. So I put it in the description of the video, and you can ask questions right here. So I'm going to put a comment right there. Hi, Ivan. Thanks for joining us. So someone here just, Ivan saying hi. Hi, Ivan. Thanks for joining us. So if you'd like to ask any questions, you can do so there. Ask questions. And that is an anonymous way to ask questions. It'll go to an email, and I have that email open right now. So you can ask those questions, and we will be able to answer them in case you don't feel comfortable asking them with your name attached to it on Facebook. So maybe we'll start with someone else talking. Elvis, tell us where you're coming from, what you bring to the table, and what we're doing here.
All right, so hello everyone. My name is Elvis Kwamupekui. I'm a resident physician in psychiatry at McGill University. And just a little bit about myself. So I was born in Rwanda, a country in Africa, and moved here when I was much younger, like 3 years old. So I did all my school here in Quebec. Did my medical training here too, and I just began my residency, so I'm first year in psychiatry. So I guess I can bring a bit of a more medical kind of perspective on things, and also just by being, as you can see, African American, so I can bring also a different look. And all of the opinions and everything I'm going to share, it's really my own, so it isn't like professional or anything, but it's really like it comes from me and my experiences. So yeah.
And also, just to be clear, Elvis, even though you are a doctor, you are not going to be giving any medical advice on this. As usual in our hot topics, anybody who's speaking as a doctor is not giving medical advice. If you have medical questions, please see your doctor, your physician. Don't take anything we say here as medical advice.
Absolutely.
Yeah. Perfect. So Himat, tell us who you are and what you bring.
Okay, so I'm a retired federal civil servant. I was a director with the Immigration Department for almost 30 years. I was born in India. I moved to England at the age of about 3. That's where I grew up. And then my family moved to Canada just after I turned 18.
Okay.
So most of my professional experience is in human rights, refugee protection. I've done a lot of work in diversity and inclusion and multiculturalism. In my retirement, I've kind of returned to my artist identity. So I'm doing a lot of work around arts and sort of mindfulness, sort of a link of those two areas. Really happy to be here.
Yeah. Thank you for joining us. Just so you joined us on another. Which hot topics was it that you joined us on?
That was on LGBTQ.
Okay, that's right.
Similar kind of issues, but for that population.
Okay, perfect. So I'm Tony. You guys all kind of know me a little bit. So I'm gonna, I guess, divulge a little more information about who I am and what I bring to the table. So my name is Tony, as you can see. The vast majority of people in Montreal assume I am Italian. I am not Italian. I am Cuban. All of my family was born in Cuba. I am the first person that was not born in Cuba. My parents immigrated to the southern United States, to Florida specifically, before I was born, when they were children. So they grew up there, but I'm a child of immigrants in the U.S., and now I am an immigrant in Canada as well. So I am now a citizen. I got my citizenship about 2.5 years ago, and so it was a long process to get there. But I grew up in the southern U.S. I grew up in the middle of Florida, which once you get north of Orlando, which is what everybody knows of Florida, it turns into the deep south. So where I went to high school and middle school, there were people flying rebel flags, Confederate flags in their trucks. The KKK had a very strong presence just outside of the town that I went to high school in. I have always been actively involved in anti-racist action. When I was a teenager in the late 90s, there were two men who were killed in Nevada, which really kind of catapulted me into using action directly. Those two young men were Lynn Newborn, who was a black skinhead from California who moved to Nevada, and actually a man who was in the Air Force named Daniel Schursty, and they were both good friends, both working on anti-racist action in Las Vegas, and they were murdered by skinheads, straight up across the board. In fact, 3 years ago, more people were charged for their murder, and this happened in the late 90s because there was just not enough information given out. So that went into the spotlight in the U.S., and that really that made me realize that this is something real that I needed to speak up against, no matter where I was. And so I've kept that fire going up until even this year. I organized a ride, despite the pandemic, a motorcycle ride of motorcycle bikers speaking up against racism. And we had 85 motorcycles turn out, which is a huge turnout. We met at the Orange Julep and rode through the city. It was really good. So yeah, we've got a lot of things to talk about. We've got a lot of people saying hello here. Hi everybody. I'm not going to put all of your things on the screen, but we've got some people coming in saying there's people from Croatian descent, Filipino descent, Lebanese descent. So we've got a lot of parts of the world represented in our viewers right now, which is awesome. So let's start talking about things. I have a list of questions. So if there's any questions you guys want to hear or you want us to answer, please just ask them in the comments. Otherwise, I've got a list that we're gonna get into here. So I'm gonna jump into a kind of an easy one. So we did a topic of PTSD recently, which is post-traumatic stress disorder. And our guest was talking about experience from war, and because he was a veteran. So now I want to turn that in and kind of bring it over to racism. And is it possible to suffer from PTSD because of racism? And that's kind of a broad question. Do either of you two have any opinions, insight? What do you think?
I think most definitely you can, if you're subject to experiences that are difficult for you for all kinds of reasons, whether it's microaggressions or whether it's something more, intense, you can absolutely end up with PTSD.
Okay. Perfect. Yeah.
Yeah, absolutely. I think it's any sort of stressor can depending on what happens, it can cause PTSD. And I think a lot of people talk about PTSD or acute stress. It's a misunderstood topic. Sometimes we think we need to experience it firsthand, but it happens in people who are predisposed that they just hear about it because it's happened to their families or to someone they know, a close friend, and it can have severe repercussions. So definitely racism can be the cause of PTSD and other mental illnesses for sure.
Yeah. And go ahead.
Just add to that, in the area of, immigration and refugee protection, under the refugee definition, there's a notion that if you're subject to discrimination or some kind of oppression over a period of time and it's cumulative, not only could you be suffering from PTSD, but it would also constitute grounds to argue that you've been a victim of persecution, which then would qualify you potentially to become a refugee in Canada. There are people who come to Canada because they've suffered racism continuously in their countries. So. And that's a basis for granting refugee status to someone.
Yeah. Okay. That's interesting. And one thing I think that came up in our last discussion around PTSD is that everyone experiences stressors differently, right? Yeah. So something that may be stressful for and maybe cause extreme turmoil for one person, another person is able to brush it off and overcome and live with that stress without it affecting them in the same way. I've said this a bunch of times when I've talked about racism with people and in person, is that the topic can be tricky because everybody experiences things differently, right? So a topic, you can say something that someone is like has a completely different reaction to because their life experiences are different than your life experiences, right? And so that's an example, I think, of of how PTSD can affect somebody, right? Is that yeah, okay.
Yeah.
Okay, so we've got a comment here. I'm going to put it up on the screen here, and it says, racism comes into several categories: skin color racism and religious racism. So let's talk about that. Let's break that down a little bit. What do you guys think about that?
I think it kind of raises the notion of intersectionality.
Yeah.
So, whether you may be a victim of racism, but it may not just be your race that's at the root of the discrimination that you're suffering. It could be your gender, it could be your gender identity, it could be your sex, it could be your class, your socioeconomic situation, where you live in a city. So all of those things combine sometimes. And, for somebody like me who's like South Asian and queer, so, I could suffer discrimination for any one or any combination of those things.
Yeah.
So absolutely, there's different kinds of racism. I mean, I think it's probably more interesting to call it discrimination.
Yeah, I think that's a good way of putting it. Elvis, what do you think?
Yeah, I think that's true. Yeah, there's many probably definitions, but for sure, saying discrimination is probably better, just in terms of it englobes so many things. So people find ways, to separate. So yeah,
exactly. Yeah. So I think one thing you brought up is intersectionality, and I think that's a good way to kind of go with this discussion, is that racism is influenced, and all these different things, all these different isms, right? Classism, ableism, all these different isms are all influenced by each other, right? So the three of us, we are all minorities, and yet we would all experience the exact same situation in a different way based on our appearance, right? Mm-hmm. And so that's kind of how these things all tie in together, and where we are and what we're wearing, and all these different things, right? We can go somewhere, and if I'm speaking loudly about something because someone's hurt, Elvis is the actual doctor, but people might be more willing to listen to me because I'm light-skinned and I can pass as white, right? And so this is an example of racism, how it plays out in the real world. Here's a question that Ivan is giving us, is how can racism create a huge impact on people? So one of the things you brought up, Hamat, and it's in our questions too, is microaggressions. And I think that these can actually have a really big impact on people, and people don't realize it. So do either of you have any insight onto what are microaggressions, or how they can impact someone's mental health? Maybe.
Yeah, absolutely. Microaggressions are kind of seemingly little things. Okay. Sometimes they're subtle and you don't always pick up on it right away. It could be a little remark or something that kind of sounds like an insult and maybe not. It could be nonverbal stuff. Mm-hmm. I've experienced stuff, for example, at work. I would go sit in the cafeteria, and then people wouldn't sit next to me. And then after a while, you kind of go, how come? Why? Yeah. And then ultimately, after you eliminate all the factors, you're left with your, it could be your race and your gender identity, and then you go, oh, that's what it is. And then you kind of go, well, why are they doing that to me? It's why do I deserve this kind of treatment? Mm-hmm. So it creates all this self-doubt and stuff, and it builds up over time. So with little things on a daily level, they just build up and up and up, and until it gets to the point where it's just too much, and then something snaps. And then either you realize that you're not well, or, you kind of acknowledge what's going on with you. I think it's the cumulative effect of microaggressions, particularly, that leads to, creating difficulties for ourselves. It's exhausting, when you're constantly kind of dealing with that.
Elvis, what do you think?
Yeah, that's really interesting, and I think microaggressions is probably the most prevalent form of racism nowadays. I think, at least in Canada, I can't speak on, maybe in the South it's still a bit different, but as you said, Himat, microaggressions are not so obvious, so that's why it's hard for people to act upon those, because they don't even know if it's really, is it because of my race, is it because of my identity, and so on. So these can, if you accumulate those little like injuries, it can obviously lead to an accumulation of stressors, and this can really lead to significant distress in people. So I think the question of Ivan was a bit kind of general, but
Yeah.
because the impact can happen, depends where you're going through racism. I mean, if you can't find a job, even though you're qualified, just because of your name and so on, this can lead to food insecurity. You cannot, finding housing and so on. So there's so much impact that racism can have on people and communities. Yeah, there's a lot of things. So yeah.
So someone said microaggressions come indirectly sometimes, and I think that's the key there, is that it's all the time. They're always indirect, and that's why they're, well, I guess they don't have to be indirect. I like to, microaggressions is like a big word, and a lot of people get kind of scared by it. I like to kind of say overt racism versus covert racism, and so like the example you gave, Elvis, is like in the South, and I don't want to say that this only exists in the South, and I think that's important. Like, I grew up in the South, and I love the South. I don't think it's only a racist place. Racism that you experience in the South, I've experienced in the Northeast, I've experienced in the Midwest, I've experienced it everywhere, I've experienced it here in Canada. So this is something that, like, I want to make sure that we don't say the Southern U.S. is the most racist place, because that's not true. But the difference between, like, microaggressions is, like, and to me at least, is overt versus covert racism. So like an overtly racist thing would be like someone calling you a slur on the street, someone saying, no, you're not allowed here because you are black, brown, yellow, whatever. And a covert racism, one example that I learned in school that one of my teachers gave was, she was visiting a friend, and she was a black woman in Montreal. She was visiting a friend, and the neighbors came up and said, oh, how much would you charge to clean my house? And that's a perfect example of a microaggression and covert racism. Like, it was a completely innocent question but it was based entirely on racist ideas. And so that's kind of what, like, can you guys think of any other, like, kind of like examples of that sort of thing? I'm trying to, like, give people some ideas of, like, something they may not realize that happens, that is
well,
I think, I mean, the person, oh yeah, go ahead. Yeah.
Is that, I remember, when I used to go shopping, when we first came to Canada, I'd go to Eaton's, which doesn't exist anymore, or the Bay, whatever. And so you'd walk in, and then all of a sudden a security guard would be following you around all over the place. And then it took me a while to clue in that a lot of the security guards would target people by their race, and they would just follow them around. And, I had money, I had, like, the ability to buy stuff, but, like, for some reason, and at the end of the day, I kind of concluded it was my race, that I'd be constantly followed around by security guards. And I had white friends that would come with me and, like, say, oh, chill, it's like they have to take care of the store, make sure it's secure. But then why is it always me that gets followed and not you? And then over time, they were able to kind of, witness to the fact that that's what was going on. So I mean, that's one example.
Okay. Elvis, you were gonna...
Yeah, I mean, there's many examples. I can think of one, like, it doesn't happen often, but as you can imagine, there's not a lot of black doctors. So there would be times, and if you look at the staff in the hospital, there's much more, like, to diversity when it comes to maybe nursing or other jobs. So sometimes, even if you wear a white coat, or even if you don't, you walk into a room, and I was once asked, oh yeah, like, somebody started talking to me, like, it was a nursing teacher, I think, and she thought I was part of the nursing, and the way she was talking, I was like, I'm not too sure I understand what you mean. She's like, well, aren't you a nurse around here? I was like, not really. And so I thought, she could have probably just asked me before who I am instead of assuming things. But, like, personally, I'm not really, like I said, microaggressions, like anything else, it depends, like, who you are and your degree of acceptance. But of course, the accumulation of these can probably lead to, like, some distress in people, for sure.
Yeah. Okay. So let's bring this. We've kind of gone into this. Let's bring this back into, like, the mental health part of things, which is like how these things can affect us. Right. It can cause, like, different forms of anxiety. Right. Yeah. There's, like, and anxiety is, like, the most common form of of mental illness, or one of the. It's like one of the top two most diagnosed mental illnesses in Canada. So if you have people who are visible minorities and they're experiencing these microaggressions and it can cause them anxiety around how they interact in a day-to-day life, we can see how this can like cause mental health issues within the visible minority communities.
Right.
So one thing I want to talk about too, and this wasn't in the questions, and this is something that you just brought up, Elvis. I attended a panel about racism and mental health in the Black community a few years ago, and one of the things they brought up was that there was only one Black psychologist in all of Quebec that was part of the order, and this is within the past 5 years, right?
Yeah.
Okay, so now we're talking about mental health, and if people want to go see a psychologist or a therapist, how is it? I mean, okay, let me get back to this. That's a good example of institutionalized racism, where someone can't go to see a doctor that looks like them, right? Like I can't go see a psychologist who looks like me, who is from where I'm from, that has this similar lived experience. So like you kind of touched on that, Elvis, but do you think you have any other like insights into that?
Yeah, I think it's becoming a problem, and a lot of research has been done in the U.S. and in Canada about the lack of representation in the medical body and in different fields such as the medical body. And lots of the studies have shown also that this lack of representation can lead to let's say some sort of fear towards like getting health and mental health treatment, or just even physical health, because people are not too confident that they will be treated with dignity and respect. So I think a lot of the faculties, not just here but in the U.S. and so on, have decided to put like measures in order to encourage diversity in the applicant pool, and because we know that this will probably eventually lead to better access and patients feeling more comfortable, when they go to the hospital. And even as of now, I think like I'm part of many committees in my school, my residency program, where we're trying to address this problem of lack of representation, because we know that it can impact our patients. And many studies have shown like, Black patients in general consult less, and in general, like their situation, like their mental or physical disease tend to be more chronic and with more complications and so on. And so there's definitely things happening now in order to address that issue. Okay. So for people out there, I think like right now there's no problem in terms of like never hesitate to go to the hospital. I don't think it's like racism everywhere or anything.
No.
But yeah, this is something that we're trying to address for sure.
Okay. Hey Matt, do you have any insight?
Yeah, no, I agree. I think that speaks to the systemic nature of racism. So like the structures that we have in our societies. And the example I was going to use is it's a personal example, so my father passed away in 2006, and then I went through essentially complex grief, just dealing with the loss, and a lot of it was around the loss to those connections of culture, history, identity, as being somebody who's from somewhere else, growing up here. And so I had gone to see a counselor, a therapist, a psychologist, I think he was. And then after the first session, what I realized is that I had become a subject for observation by the psychologist. So basically, it was like I was kind of bleeding my heart to this guy, and then basically it was just taking notes, and there wasn't any kind of he wasn't responsive to what I was putting on the table, and a lot of it was, I think, that he just didn't know what to do. And as Elvis was saying, he didn't understand intersectionality. He didn't understand the role of migration, in building somebody's identity, and the fact that having grown up in different cultural sort of locations across the planet, and what all of that means. So I think those are skill sets that there's still a lot of work to be done to develop, so that we can get the kind of help we need from our health system.
Absolutely. So we've got a lot of comments and a lot of questions in the side here, and I'm going to start trying to get through through some of these. There's a lot of good comments, and so let's see. Okay, so this is a good one. This is someone using someone else's account here. They're saying you might want to discuss the discrimination lived by racialized persons who have mental health problems, living multiple discriminations, the stigma because of mental illness combined with discrimination due to skin color. And this ties in really well, I think. Yeah, these two things tie in really well. Elvis, do you have any insight into this?
Well, it's a good question. There's many aspects in this question.
Yeah.
So yeah, I'm just trying to like see exactly.
Yeah, there's a lot. There's a lot to unpack here, and it's
yeah. But for sure, I understand this, and I mean, like, I just go back to like some of the stuff that we've been doing with our like some of the groups that I'm part of in psychiatry, and we've been through the literature, and we were seeing like, for instance, patients in psychiatry emergency who are Black tend to be injected more often with certain medication to calm them down versus the people that are non-racial. So we know that there is a problem, and I think that with the whole movement, I think the Black Lives Matter, all that's taking place in the U.S. and that is also taking place now, it's not only moving things on a political level, but everywhere, and even in mental health and in medicine, people are starting to question, whether they have a role to play, because when it's systemic, it means it's pretty much everywhere.
Yeah.
So I think it's good that we have even this chat today. I think this shows, how important it is. And I think that even in the medical body, like, people are starting to realize how important it is, because there is a lot of discrimination. So it's a good question. Yeah.
Ahmed, what do you think?
I agree with that. I mean, I think the question is there's a lot of layers to that question. I think also one layer that I see there is the whole sort of internal side. I mean, as people who belong to minorities, sometimes what happens is we internalize what we're seeing without realizing it. And then so that kind of affects the way you behave. And then after a while, if you're kind of self-aware, or if you're able to develop your self-awareness, or you have somebody who's counseling you who can help you do that, then you start to realize that what's happened is you've internalized. So if somebody's been discriminating against you because of your identity and who you are, then what you may do over time is internalize the fact, though. So if you're BIPOC, if you're Black, Indigenous, or a person of color, then over time, sometimes what can happen is you accept this sort of racial hierarchy that's been created by society, and then you kind of see yourself as lower on the ladder than like heterosexual white people. So and if that's internalized and you haven't realized it, then it could be affecting your behavior and your health over time. And so it's good on an individual level to kind of introspect and look at that and unpack it.
Yeah.
And then sort of try to understand what it is that's affecting you. In my case, I found, like mindfulness meditation has been really useful for that. So kind of just making myself aware of, okay, I'm jumping to assumptions here, and it's not really something that's wrong with me, but I think probably what's happened is I've internalized this aspect of, a societal structure that puts me at the bottom of the ladder. The example I would give is in kind of mid-career, I was looking at becoming a manager, and then my supervisors were saying, oh, you're not ready yet, you need more experience. And then watching sort of white colleagues with much less experience being promoted and promoted and promoted. And then after about 3 years in one position I was in, the manager finally came to me and says, oh, hang on, so why aren't you applying on this competition for that promotion? And then I was really honest. I said, look, well, you skipped me over like 4 times in a row, and you said I wasn't ready. So, and then the reality of the matter was that they had run out of people to fill those positions. So now, all of a sudden, I was ready. So it had nothing to do with me or my competency. It's just there was a racial filter at the front end of that process.
And the chances are they didn't even realize it. Or they definitely didn't realize it, right? Yeah. It's just how, it's the way we've been socialized that it's just normalized these things. One thing that I think that is good, it's interesting to bring up about, that kind of touches on something that you're both saying, is the differences in different cultures, right? Like, my family is Cuban. We are we're loud. We don't talk quiet. We talk with our hands, as you can see. Like, that's a cultural thing that, since I've moved to Canada, has taken me a lot of work to, like, not get out of control. Like, I still talk really loud, and like people think I'm mad sometimes, but no, I'm just talking loud because that's what I do. That's how we, like, how if you go in my house, it's like loud. There's no other way around it, right? And so that's a good example of what you were saying, Elvis, where people get injected with things. If someone's loud because that's just how they express themselves, and doctors think they're out of control and are in a moment of psychosis, but they're not actually. That's just like they could just be being loud. That's how they express themselves. And one thing, when I was researching, I probably did way more research than I needed to for this for this discussion. One of the things I found out was that more black men in terms of based on I don't want to say per capita, but more black men are diagnosed with schizophrenia than white people because of different cultural differences and because of the way doctors are interacting with them and psychologists are interacting with them, and that's something that only recently came out, right? So this is this is definitely stuff that's still coming forward in medicine and in social things, and I think that
maybe for the diagnosis, I don't know what study that was. It'd be interesting to read this, and I think that to diagnose a patient, there are certain rules. I don't think people take it lightly, so I would hope that they don't overdiagnose just because of cultural differences. But there are definitely many things that lead to disease, such as what we call social determinants of health. And in certain populations, let's say we're talking about income and social status. If you live in an area where, let's say, Black people on average don't have the same income and so on, then you can see that these have an effect on, the rates of, disease and so on. So maybe this could be explaining some of that. I would hope it's not just because of cultural differences. But I think, sometimes there is a lot of difficulty communicating, and we can think of patients who sometimes cannot even speak English or French. So imagine, especially in psychiatry, having to conduct an interview with translators. So sometimes we lose a lot of that sensitivity that we need to really understand what the patient is experiencing. And this could sometimes maybe lead mistakes. I don't think it's the case very often, hopefully. But this is where I think having more representation in the workforce can help a lot. And also conducting more studies to see if there's maybe social determinants of health, things that we can tackle in order to avoid having this overrepresentation of a certain group with a certain disease, because these are things we can modify, social status and so on. So,
All right, so we've got a bunch of comments here. This is one question going back to microaggressions, and it scrolled by really quickly. So I'm going to put it on the screen here, and it's, how do we know if it's our impression of an event or an actual microaggression? It's a hard one. So what do you guys think?
Well, I think, like we said, it's part of the definition of microaggression is that it's so subtle that it's not obvious, and it's hard to find out whether it's true or not. And everyone has their own ways of dealing with things, and it depends also on the context. I personally was always raised, not to be my mom always told me, try not to be a victim, and you hear that a lot, or try not to look for that excuse. I don't think it applies to every situation. Sometimes it's obvious there is racism, and you should speak up, and people around you should support you. But it's a very different, it's a difficult thing to actually determine whether it is microaggression or not. I think it's a general question. I don't have a specific answer to that.
I don't know. Some of these questions may not have an answer, but it'll get us talking. Hey, Matt?
Yeah.
I think the question is really good. I think in terms of validating whether it was a microaggression or not, it is a subtle thing often, most of the time. I think one thing that's helped me in the past is kind of just sitting down with a friend or somebody who I trust or an ally and just saying, this happened, and I'm feeling really upset. I just want to talk about it and just have that person there to kind of listen to you and in a non-judgmental way. And if it's somebody you really trust, then maybe feedback will come. But I think what it points to is the whole issue for me is how important it is to build your resilience, your own personal resilience. So, and that's about your family, your community, your spirituality. And, and it's important to stay aware of what's happening with respect to social justice. Not lose hope and look at what continues to advance. Um, and I think in that way, you kind of empower yourself to deal with those incidents that are happening on a daily basis. And if you don't invest some time and effort in, building and maintaining your resilience, that's when sometimes, there may be risks that are greater than if you've lost that resilience. But I think in the time we're living in, with the extra added layer of COVID, which is causing a lot of, there's a kind of an intersectionality there around the Asian communities in Montreal, for example. So Asian communities are experiencing a level of racism that they haven't in the past. And so what you see is initiatives, like there's a Facebook group, for example, for Asians who are interested in or who have experienced racism, subsequent to the appearance of COVID. So I think it's really important to try and keep building community around ourselves. And I think it's almost like a non-medical way, but it's a way of, ensuring that inside you continue to have that strength that supports your keeping your resilience alive.
Yeah, it's really good.
Yeah.
Yeah. I maybe had something to add. I think just in what you said, it's true that sometimes when you're going through these events, you're not too sure, is this racism, is this not? One thing that we learn now, and I think that's what's the big difference I feel personally with this new movement of Black Lives Matter, is that's the first time I hear people that say, they're not necessarily minority group people, so let's say white people, saying, we've had enough. Staying silent, it's being it's kind of like maintaining this thing. So if you're you need to stand up when you see something that's not right, because sometimes those microaggressions happen in front of you, and then once you're not there, maybe they start talking, they're saying other things. So it's up to your colleagues or whoever is around to really speak up, because there's no way for us, the victims of those things, or those who have been victims of those, to be the only ones to bring the change. We need the change to come about if everyone's concerned.
Right.
So yeah.
So you've brought up two really good things that I want to touch on. One thing you said was your mom always told you not to play the victim, and that's a perfect example of the life that visible minorities have to live in order to survive, right? Is that we constantly have to question whether or not we are playing a victim, or is this actually something that's happening to me that I should be speaking out against, right? And so if you were to ask, and the interesting thing about that specific line is that that's something that white fathers say to their white daughters, right? Don't play the victim. And it's interesting because that's where the intersectionality comes in, is that and rich people say to poor people, don't play the victim, pick yourself up by your bootstraps, right? These are it all ties back into mental health in terms of of what you're constantly thinking about every day, all the time, and that anxiety, and that's all these little things that you have to do. And the other thing I wanted to speak to kind of touch on was that you said that you're glad that white people are starting to, and they have been for a long time, they're starting to be able to speak out more. And I think that's important because there is this cliche of the angry black man, the angry black woman who's just speaking out and yelling at someone because they're speaking out against someone being racist to them, and how tiresome that can be, of having to constantly call everyone out every time someone does something. If you call someone out every time, you'll never shut up. You'll just never stop talking, because it's just, there's things that are constantly around you that people don't realize. Yeah. Anyways, those are just things that I like you said that I think are good. Someone asked a question through the email that I think is important to address. They asked if there's a list of Black, Indigenous, or people of color, like BIPOC. That's a BIPOC. That's something that Hamat said earlier. Is there a list of the BIPOC therapists in Canada? So Quebec has the Order of Psychologue order, or whatever, the psychologist order. And if you go to the website, you can actually sift through based on language, based on ethnicity. So there is a way of doing that, and a way of like getting closer to seeing. I don't know if ethnicity is actually one of the categories, but there is a way, and I have done it in the past to kind of like look through and see. And I'm pretty sure ethnicity. Someone would have to double check on the website, but you can check through and see, because there are many people of color who are practicing psychologists in Quebec. However, when you compare it to the number of white people, it's not even close. Even when you compare it to the number of like when you compare it to the population, it's not close. It's the same with doctors, I assume, right? There's different ethnicities and races are more present than others for various reasons.
But I wonder.
Yeah.
I wonder if like the community health, the community mental health resources that exist,
Yeah.
Across Montreal, the greater Montreal, probably some of them I would imagine you can phone them and say, if you don't have someone who's like, Black, Indigenous, or South Asian or whatever, you could probably sort of inquire, is there someone who has experience with those?
Exactly.
Well,
And I think that's that's definitely a step in the right direction, and that's, you'd have to reach out. I wouldn't be able to possibly list all of the different community organizations, because there's lots of them. I know that there is currently an organization that just became a QPERG working group that is specifically focusing on Black mental health in Montreal, and they're raising money to be able to pay back Black people to go see a therapist, right? And this is a new thing that has happened within the past 2 weeks. It's like I know they're on Instagram. I asked them if they could speak, and they weren't able to coordinate with me, but
and just to add on this, but that's really interesting. And I think like, even ideally, I think if we project ourselves in a few years, I think like ideally what we're trying to do as well in training like future physicians and so on, is to adopt more like to get more cultural competence, because ideally you don't need to have a Black psychiatrist because you're Black or Black. You would want to be able to go to the emergency, and whoever sees you has been trained properly to be culturally competent in assessing whatever kind of patient they're dealing with. So that's also something we're pushing on, so that people in the who are listening to us don't think we're just looking for matches and perfect matches. I think that's not the idea. It's really to be culturally competent and respectful and mindful for every patient we have. I think that's the key here.
I think that's an incredibly good point. I actually had to give an example of like what you're talking about. I went to a therapist recently in order to try to start talking about how I was feeling about being an immigrant, and where I grew up, Spanish was my first language. So growing up in South Florida, hearing Spanish all around me was never a concern. But when I'm in Montreal, I never hear Spanish. I have to go to specific places to hear it. I've lost almost all of my Spanish because of that, and it's hard. And so I wanted to see someone to talk about like how I'm feeling as an immigrant, how I'm not around like that diversity that I'm usually around, and like how I can like work around those feelings around that. And I mean, at the time, the person that I saw just wasn't able to help with that, because that's something that he was a white man, and he helped me with other things, and we talked about other great things, but that specific topic was just not something that we could really get into, because he just wasn't trained about it. He didn't know anything about it. He wouldn't, and this is kind of exactly what you're saying, right? Is that we shouldn't have to seek out people who look like us, quote unquote. That everyone should be competently trained to be able to tackle all of these subjects, but that's not always the case, sadly. So, all right. So let's see what else we got here. I'm trying to like scroll through these questions and answer them at the same time. Again, if you have actual questions and comments, keep putting them forward. I am reading them. Some of them are hard to like bring up in terms of the discussion. One. You know what? Let's go to my questions. Let's talk about intergenerational trauma. What is that? I've heard it before. Other people have heard it before. I know what it is, but maybe some of the people listening don't know what intergenerational trauma is, because this doesn't only apply to racism. It applies through other things as well, but I think it's a very good topic specifically around racism. Either of you have any insight into that?
Well, certainly in terms of refugees, and then in my own family as well, My parents were born in India, and they were children when partition happened, when India and Pakistan were created by the British, when they split, the subcontinent into two countries. So they were forced to flee the towns, the villages where they were born. So that was quite traumatic for them. And my mother certainly experienced, she witnessed like incidents where there was communal violence, where there was you could compare it to civil war in a way. Like people were being killed by other like racial or cultural or religious groups. The British had created division and then they left. So, just the trauma of having to abandon your home forever where you grew up and then never being able to go back. I mean, that's huge in terms of the trauma. And then ultimately what it does, it affects your behavior and the way you kind of evolve into adulthood. So in both my parents had certain behavior patterns that I didn't always understand. And then my mother was someone who was super, super, super protective. And then it's only much later in life that I understood where that came from, because she was kind of like a surrogate mother of her family, because her own mother was quite frail and she passed away when she was quite young. So, and then my mother's maintained those behaviors through her life. So she was very protective of us as kids. And then in situations where we were really secure and there wasn't any danger. And then it's only later on in my life that I understood that, oh, wow, this is why she's like that. She's not deliberately being like that, but this is a function of her life experience. And once you understand that, it kind of opens this window up into understanding how you yourself are then also a product of that, because then that trauma has been transferred through the generations to me. And so it affects my behavior. So as a kid, after a while, I really needed that kind of protective kind of shield around me all the time. So when I became an adult, it took me a while to learn how to deal with some of those things that you deal with on an everyday level, because I didn't have that protection around me anymore. I didn't have my mother going, oh, don't do this, don't do that, don't go there. And so I had to kind of figure all of that out for myself in my 20s. So, and if had I had I don't know what normal is, not a word I like, but had I had, a regular kind of upbringing, I may not have had those kind of challenges to deal with.
So, Elvis, you got any? No, that's.
Yeah, I don't.
Yeah,
That was a really good.
that's a good explanation.
Yeah, but it is something I think that we can even see in the clinic for sure, intergenerational or what they call transgenerational.
Okay.
And it's really hard to tackle, like you said, because it has to do with how you were raised, and it somehow has to do even with your identity somehow. So it's a really big topic, and on a single level, there's ways to obviously tackle these issues, but there's also like probably more of a like community or even social way to tackle it, because it usually happens also on many people live through the same trauma. So yeah, it's a big topic for sure. Yeah.
Cool. All right. So let me see here if we have any other questions. If anyone's got any questions, if you've got anything you want answered, we've got about 12 minutes left. I'm going to jump into now a little bit more of the institutionalized racism, specifically in medical field. So Elvis, you're going to be put on the hot seat now. There was a situation recently that happened, I think it was last week, maybe the week before, in Joliet, where the Native woman Joyce Echaquan, I hope I'm pronouncing that right. She was in the hospital and she recorded nurses essentially just saying racist stuff, saying she was only good for sex, saying all kinds of things just because she was a Native woman in the hospital. And I think you touched on this a lot, Elvis, about being cultural sensitivity and and stuff like that. How can we address this more? What can we do about this? Like this is the question that I have, right? Because this is nurses essentially killed this woman, like flat out. And I'll say it. That's what they did. They killed this woman because they refused to give her treatment. They injected her with medicine that she was allergic to, I think is what the final cause of death was. And they weren't taking her pleas of of pain seriously. Yeah, I don't I don't know if either of you have
a heavy topic.
Yeah, it's a super heavy topic, but I think that in Canada, like in the southern U.S. or in the U.S. in general, anti-Black racism is, I think, across the board the biggest topic that people talk about. And I think that in Canada, racism against Indigenous people would take that card, I guess you could say, in terms
there's
of.
There's also been a second case in Chicoutimi, like it was today, yesterday.
Oh, jeez.
There was a man in the hospital in Chicoutimi under very similar circumstances. But I think Elvis has spoken a lot to that in his earlier comments around, I think it's beyond just a need for training. It's like, good God, if we've given enough, it's like, how much training can we give? At some point, I think there need to be like, just structural things that say, if you do this, then here are the consequences. So you can't be racist towards, people coming to you to seek help.
Yeah.
I mean, doctors take the Hippocratic Oath. Nurses probably have something similar. I mean, I've been in hospital with my dad, who was like having in the throes of a heart attack. And then the nurse started to have a constitutional debate with him because his French wasn't fluent enough for her liking. And I lost it. I'm telling you, I lost it. They ended up throwing me out. I just said, this is like totally not on. You cannot treat someone who's coming to you for medical help like this. As a medical professional, there's certain standards that you have to adhere to, and you're supposed to be bilingual. And if you're not, then go get someone who can speak to him. Because I don't know the medical terms. I'd be happy to translate, but I'm not sure I can translate accurately. So, and things like that still happen. People go to seek treatment, and for whatever reason, they're not treated appropriately. Elvis was saying earlier on, and I agree with that because I've seen stuff like that, where people from minority groups are just subscribed a pill. Like, go away and take the pill. Instead of getting, the thorough kind of counselling and treatment that they actually need that's going to help them, heal. So, and I think if doctors, nurses are not doing that, there should be consequences when they're found out. And I think that's the part that's missing, in my opinion. That's my very subjective opinion.
No, I agree with you. I think there's many ways to tackle this. Like you asked, what can we do when these things happen? First off, on a personal level, like I said earlier, we need to speak up. When we witness any wrongdoing, any inappropriate comments, there needs to be a place for us to speak up. Maybe not directly confronting, because sometimes it can get out of hand. But like we said in the second point, we need to have institutional reform so that when things like this happen, there are consequences. There's someone you can report to directly who's going to investigate. And I think what really saddened me the most was to see the reaction from, let's say, the politicians who went on to even denying that systemic racism exists. I think that is actually a proof that it exists, because they're not willing to do anything to stop it from happening. And that's what it is, systemic racism, because it takes place. And they're not willing to put regulations to address it. So it's very sad, and hopefully I was at least happy to see that people marching in the streets of Montreal, there was a social, at least concern about what happened, and hopefully that was the last one. I hope it's not, and I think sadly there might be other cases like this, but
sadly there will be, because it's not the first.
So but if we put pressure on the government level, and even just us trying to be very aware of these things, I think we can little bit bring a change, but it's not new. I think this has been there for a long time, and it's just that now we see it because we have our phones, and we saw the George Floyd thing because now we have the phones, but this has been going on for years.
It's not that this hasn't been happening for a long time, it's that it's been there. And I kind of want to touch on something that you said, and it's we were talking about this in our staff meeting with my coworkers and I, and I can't remember who it was, but they brought a really good example of how institutionalized racism and how people are getting mixed messages and how they're not sure what to think, right? So you're like, okay, on one hand, you have all these people literally marching on the street saying, this is a problem, we need to address this. And then you have Legault saying, institutionalized racism doesn't exist. Now, I think across the board, we can all agree that the United States has had a bad response to the pandemic. And if you disagree with that, just unfollow and close this and whatever you want, because the science and the numbers don't lie. So, however, despite the fact that they've had this bad response, the government is saying you don't need to wear a mask, everything is fine. So you have these mixed messages, so people have a hard time knowing what to believe. And I don't place blame on people for being confused when you're getting told by the government on one hand, don't do this, it's fine, and you're being told by medical professionals, do this, you need to do this because this is what's going to help. And so we're seeing the same thing with systemic racism in Quebec. We have people saying, these are the things that are happening here, concrete examples, and yet we have the politicians in charge, on the other hand, saying, this doesn't exist. What are you talking about? Right? And so if you're confused, I understand why. Yeah. The thing is to try to look past that confusion. So Mark asked us, he's a white male here to learn, what are some resources to start with? I got a bunch together. I'm going to put a bunch of links at the end of this discussion, just because if I put them up now, they're going to get lost in the comments. Just to give you an idea of some of the things. Some of the things is that I have a list of TED Talks specifically about racism and mental health. I have a bunch of books, a bunch of things that are going through that you can read. I am going to post one right now, and it was put out in 1988. So that tells you how old this is not a new issue. Okay, this is something that has been going out. This is written by a white woman named Peggy McIntosh. It's part of a much bigger essay, but this specific section is called White Privilege, Unpacking the Invisible Knapsack. And I'm pretty sure I posted it on different, I think I even posted on the LGBTQ one, I'm not sure. But it gives you like a list of, I think, 30 questions that kind of like help you wrap your head around what white privilege is. And once you can understand it, then you can better know how to respond to it. And I think that that's a good thing. So one person, Martina, said, here, I'll put it on the screen so you guys can see it. Their books, a good one is my Prof. Ratnagosh. Prof, if you have access to Google Scholar University Library, how you do not want to be treated. Okay, so that's like, don't treat others like how you don't want to be treated. That's like the golden rule, right? Do unto others as you would have them do unto you. And then Nadia says, I think spreading awareness, education on this subject is important, and that's why we're talking about this, to try to get people talking. I'm not going to have all the answers. Elvis isn't going to have all the answers, and Matt's not going to have all the answers. A lot of things it's impossible to have all the answers, so all we can do is talk about it and get everybody talking. We got about 3 minutes-ish left. Is there any thing that you guys want to kind of talk about? Anything that you think we've missed?
Well, I think that last question was good in terms of, to me, it kind of links to the whole notion of allyship.
Yeah.
So, and I think part of that is just this kind of natural curiosity that we have as human beings. And then I think it's important to kind of explore that curiosity. So, if you're not part of a minority and you want to be helpful, you want to be an ally, just what are the questions that you have inside of you, and find a way to ask them respectfully. And I think in my experience, people who've come to me like that, with a question that they're asking authentically, with the desire to understand, then the person who is from, the minority group will be much more inclined to answer the question, because it's like a substantive discussion with the other person. So I think it's really important to be authentic and to be, respectful. And I think as long as you maintain those kinds of values, then that's the way to open those doors to mutual understanding.
Mm-hmm. Elvis?
Yeah, I mean, maybe the last word is, I mean, it's in the middle of the pandemic and
Yeah.
people are like staying home and so on, but never to hesitate because for a while I think we saw numbers dropping in some hospitals. So if ever you're dealing with mental illnesses, substance abuse, so on, never to hesitate. It's safe to go to the hospital. We take good precautions. So
Yeah.
yeah, it's important to remain like healthy as much as possible. So
Yeah.
yeah. Mhm.
One comment that just came up, which is Jean Noel. Once you arrive to Canada, you get cultural shock. It happened to me, an intergenerational topic I'm lost here. And I think this is a really good, I think it's kind of a good way to kind of finish this topic is that if you're feeling like you don't understand what's going on because either you're a new immigrant or because you're just confused, I think it's good to reach out to the community resources for whatever community you're from. If this is the basis of your topic, right? Like, if there's a lot of community resources in Montreal, tons. Every single and I can say this without doubt. Every cultural identity has a community group in Montreal. We have everything. So reach out to those community groups and talk to them. Maybe they have a meetup where they go eat in the park one day. Maybe they have like a night where you play pool or board games. Or I don't know, pool. Do people play pool anymore? Anyways, and you can meet up with people who are part of your cultural identity group, and they can help you wrap your head around these things, and you can talk about these things because nobody is alone in what they're experiencing. What you're experiencing, other people are experiencing as well. And sometimes those people have had time to talk about it and help and work through those issues. And other times just talking with people will help you work through those issues together. So that's my parting words, I guess, is to don't feel overwhelmed by what's going on and to try to reach out and talk to people. It's going to help your mental health, it's going to help your physical health, and it's going to help you build community. And we can't go anywhere without each other, basically, you know. We can't get through this alone. That's across the board. So, yeah. Any last things, anything, guys? No? All right. Thank you very much, Hamat. Thank you, Elvis. I really appreciate your insight into all of this. You guys have been great. Thank you so much, everyone, for all of the comments. You guys, I couldn't get to all of them and put them all on the screen. I really like to do that. There are so many comments. And like, it's a lot of really good feedback from people and people talking and discussion and stuff. And after this is all over, I'm going to post all kinds of different links just to give you an idea of some of the things I'm going to be posting. One of the things I'm going to post it again right now before I say goodbye. There is a website called racialequalitytools.org. There are so many resources on this website. It's where I got the PDF of the white privilege and unpacking the invisible knapsack. So check that out. There's so many essays, books, resources. There's like thousands of things that you can check on there, and I encourage you to check that out. I'm also going to be posting some other more like heady books about theory and more popular books. I'll post a couple stuff. So yeah, I'll be posting that all after this is all done. You'll see it in the comments. For now, good night, everybody. And again, thank you, Elvis and Hamad, for joining us. You guys are great.
Yeah.
Thank you.
Thank you. All right. Bye-bye.
Bye-bye.